Okay. I'm really happy to take my new voice.
My problem started when I was 12 years old.
This will definitely motivate people who are suffering from similar situations.
I have high pitch voice problem.
तो अभी तो सर मेरे को बहुत अच्छा लग रहा है, वॉइस में काफी फर्क आ रहा है.
Okay. I actually had this surgery in the back and
You said, I'll take it as a challenge and I'll give you your voice back without any invasive procedures.
After surgery, I have vocal cord paralysis. And now I can speak normal. I feel good.
Hi, I'm Cyrus. Hi, my name is Cyrus.
Hi, I'm Sean. Now my voice has recovered and improved.
इसलिए मुझे बहुत ही प्रॉब्लम, मैं पहले से ज़्यादा बेहतर महसूस कर रहा हूँ.
My name is Rehabilitation,
and I'm very happy that I'm speaking like a normal people with a bass voice like male.
So I'm having this voice problem. I spoke with a few of my friends and they found reasonable changes in my voices.
I've been facing difficulty in speech. You are able to speak words properly and sentences properly.
just you try to say something.
treatment is still there. After 2 hours I got my voice.
Hello friends, welcome to our YouTube channel SLP Sanjay Kumar, voice therapist, and today we are live before treatment, and the person who is with us is not from India, and he is having unilateral vocal cord paralysis, and in the future we are going to be post treatment live also, and today date is 15th of January 2022, and please subscribe our YouTube channel so that you can watch his post treatment live as well. So नमस्कार दोस्तों, आप सभी का स्वागत है और आज हम लोग लाइव हैं अपने YouTube चैनल SLP संजय कुमार वॉइस थेरेपिस्ट पर, और आज हम ट्रीटमेंट से पहले लाइव हो रहे हैं और आज डेट है 15 जनवरी 2022 और भविष्य में हम लोग ट्रीटमेंट के बाद भी लाइव होंगे. आप लोग हमारा YouTube चैनल सब्सक्राइब कर लीजिए और भविष्य में ट्रीटमेंट के बाद वाला भी लाइव जरूर देखिए. Yeah, so tell about yourself, your name, where you stay and why you contacted us.
Yes, my name is Tushanta. I am 49 years old and I am from Melbourne, Australia. I have contacted Dr. Sanjay regarding my vocal issue, and I gone for the few tests, and they was telling me left vocal cord is not functioning well. So that's what my issue. And I was searching the internet about the voice therapy. Then I have found that Dr. Sanjay have done some vocal therapies and many videos. So that's what I was interested to contact and try to do voice therapy for myself.
So why you took a decision of voice therapy, and this was the method this means suggested by your doctor or some other method they first suggested?
No, actually they have first checked with the cameras and all. Then after that they asked me to do the CT scan as well, and then they decided to do for the surgery. But in between, because they have suggested me to do within 1 month, but in between the COVID situation, this one is postponing now. And in between, I was thinking maybe do the voice therapy because one of what it happened, one of my friend's place, I went for the party, and then he was doing the karaoke, and I was singing as well. Then in between, I was thinking the next day I realized that the voice is become good, better than the last day. So I was thinking maybe voice therapy is better option to go for the surgery. That's what I was thinking to search.
Yeah, so it was, I think, an interesting coincidence. But in our voice therapy, we'll try to bring your vocal cord more closer together because there is a gap due to the vocal cord paralysis. And in this live, we are going to discuss about the normal speech production mechanism, why the vocal cord paralysis happen, and what we are going to do in the online voice therapy. And I'll be also giving some tips to keep the voice healthy. So those who are watching this video, please get connected with us. And even I'll be discussing what are the other communication disorder for which we provide our services and how you can differentiate between the certified speech language pathologists and healthcare quacks, because nowadays in the social media, so many healthcare quacks are also there and claiming that they are the speech language pathologists. So one question from you, because you are staying in Australia. So anyone has not suggested any healthcare professional or any doctor to go for voice therapy? Just for awareness, I'm asking.
Actually, I asked with the surgeon as well, but the surgeon did not tell me about to go for the speech therapy. Myself, I was get the decision to do that.
Okay. So what I personally feel, awareness is slightly less all over the world, not only in the India, I can say. You are in Australia and there also they are directly suggesting for the surgery. And any idea what they told after surgery, how long will be the effect?
Yeah, they told me the surgery is going for the temporarily. It is for the 6 months. And in between they said, maybe the vocal cord will start functioning. Then it will be okay. But if not, then they said permanent something, they have to do it. Like maybe like plastic surgery or something. I'm not sure 100% what they are thinking about that.
So what surgery they told they are going to do and that will last for the 6 months? What was the...
They told me they will put the injection and they will do the centralize of the left vocal cord. Then they said my voice will be back to normal, but it is not a permanent solution.
Okay, so in the injection, what they're going to put? Fat or what they told?
They didn't tell me exactly what they are going to do actually, but they told me roughly that that is injection and going to give for the vocal cord.
Okay, so you can mute your mic and I'll be now discussing about the normal speech production mechanism just to create awareness across the world and what can be the cause of the vocal cord paralysis and what exactly we do in the online voice therapy and why you should choose first online voice therapy, any voice therapy technique. That is based on my opinion. So that also we are going to discuss. So let's understand the first normal speech production mechanism. Then it will be easier for us to understand the abnormal speech production mechanism. For normal speech production, first thing is the thoughts that comes in the brain. Then we take air, that air goes to the lungs. When we breathe out, we put air pressure below the vocal cord. Here we have larynx. Inside the larynx, we have two string-like structures known as vocal cords. So once you put air pressure below the vocal cords start moving like a string of a violin and guitar and sounds generate. Then we modify that sound into different sound with the help of our articulators. Lips, tongue, jaw, teeth, palate, these are known as articulators. So when you say a one sentence, so many things happen at a time. Thoughts come, we take breath, we put air pressure below the vocal cords move, sound generate, we modify that sound into different sound with the help of our articulators. Like if you want to say pa, both the lips are coming closer together and touching each other. When you want to say ta, tongue is coming between the teeth. When you want to say ka, back up, the tongue is getting elevated and touching the soft palate. So each and every sound has own place, own manner of articulation. So when you say a one sentence, so many things happen at a time. Thoughts come, we take breath, we put air pressure below the vocal cords move, sound generate, we modify that sound into different sound. In one sentence, there are so many words. In each word, there are so many sound. Each sound its own place, own manner of articulation. So it is little complex process. In this process, there are hundreds of our body muscles works in a very, very coordinated way. If coordination among these muscles goes, fluency goes. So that can be seen in case of a stammering or a stuttering. There will be lagging the coordination among the speech production muscles with the brain. And now let's concentrate on your issues. So here we have larynx, as I told, and in the larynx we have two string-like structures known as vocal cords. So when we say ah or anything we speak, so both the vocal cord will come closer together, and there will be very small gap. While suppose we are saying ah, for example, so very small gap will be there in the normal case, and then air will come out during the speech production, during the sound generation. And in your case, what has happened? The one vocal cord has paralyzed, left vocal cord, I think. So yeah, so what is happening when you are speaking, or suppose you are saying so left vocal cord is not moving, only right is moving. So because of that, there is a gap between these two vocal cords. So a lot of air is getting wasted, because for sound generation we put air pressure below the vocal cord, and because of that air pressure vocal cords moves, and now the lot of air are escaping. So the air which was supposed to be used to vibrate the vocal cord, and that is not sufficient because of the wastage of the air due to the phonatory gap. So the amplitude of vibration of the vocal cord is less, and the loudness will be there. At the same time, loudness will be less. At the same time, air is getting wasted. Lots of air are coming between the vocal cords, so the voice will be breathy. So those who are the patient of the vocal cord paralysis, the symptoms can be perceptually, you can observe loudness will be less, there will be breathiness, and the hoarseness will be there, because the one vocal cord is vibrating, other is not vibrating. There are two strings and they are not in unison, so there will be hoarseness symptoms as well. And so what we are going to do in the voice therapy, and in fact I'm going to give all the instruction through the online, so I can say it will be a kind of online voice therapy. But when the patient come in the clinic, we apply the same technique when we are giving online voice therapy, but only the medium of instruction will be through the tele-rehabilitation mode, means by the video calling, and there will be directly I'll be doing that instruction, giving that instruction. So our idea will be in the voice therapy, so either stimulate the left vocal cord. There can be chances with the voice therapy I'll be able to stimulate, because I have seen in some patient after the therapy, once they will go for the stroboscopy or laryngoscopy, we get feedback like, yes, the vocal cord started moving. And I have also seen the patient where the paralyzed vocal cord will not start moving. Then why the patient voice improved in that case also? What will happen? Right vocal cords will come more towards closer to the left vocal cord. There can be a situation when left will start moving if the left is paralyzed. If it is not, then we'll bring the right vocal cord more towards the left one. And if it is coming more towards the left one, the air gap will reduce, phonatory gap will reduce, and overall voice quality will improve. So this is the biophysics behind the problem. And the nerve which supply to the vocal cords are like, it's part of the vagus nerve, branch of the vagus nerve, and it's called recurrent laryngeal nerve. And because of the surgery, sometime thyroidectomy, and sometime even I have seen in the cardiac surgery also, sometime in case of tumor surgery also, and sometime some injury in the throat, sometime idiopathic, we don't know the reason, sometime maybe the viral infection or bacterial infection, the nerve which supply to the vocal cord, that is recurrent laryngeal nerve, get damaged, and in that situation the vocal cord will not move. Sometimes one vocal cord will not move, we call it a unilateral vocal cord paralysis. Sometimes both the vocal cord will not move, we call it bilateral vocal cord paralysis. And the idea of voice therapy is to, in case of unilateral vocal cord paralysis, and in case of if it is adductor bilateral vocal cord paralysis, we also try to bring the vocal cord more closer together. When the bilateral abductor vocal cord paralysis is there, so I think it's best way to take the help in some hospital, because there will be some breathing problem, because both the vocal cord has already in the closed position, so there will be problem in the breathing. So when it is a like adductor vocal cord paralysis, in case of bilateral vocal cord paralysis, then it is good candidate for the voice therapy, I feel. And unilateral vocal cord paralysis are also good candidate for the voice therapy, but bilateral abductor vocal cord paralysis are not good candidate for the voice therapy, what I have learned. So this is the way how we are going to work. And as I told in my live, I will be also informing what are the other communication disorder for which we provide our services. So those who are watching this live, for other communication disorder, what services we provide, please explore our YouTube channel playlist. You will find different playlists for different communication disorder, and all the playlists will be having pre and post treatment videos. So that will give you an idea how a certified speech language pathologist and audiologist changes the life of people having communication disorder. So you'll be able to find the playlist for the patient having vocal cord paralysis. You'll be able to find the playlist for the puberphonia, high pitch voice or feminine voice in case of male. You'll find playlist for the stammering. You will find playlists for the spasmodic dysphonia. You'll find playlists for the phonatory gap, sulcus vocalis, misarticulation, aphasia, functional aphonia, functional dysphonia, and even after the doing hearing evaluation for the right candidate, once we fitted the hearing aid instrument, how their communication improved, that kind of video also you'll be able to find. So please explore our YouTube channel playlist and you'll get an idea how a certified speech pathologist audiologist changes the life of people having communication disorder. And I also told I'll be giving some tips, 2 questions answer. I have to give 2 information. One is the how to find the certified speech language pathologist, or how you can differentiate between the fake speech therapist and the professional speech therapist or professional speech language pathologist. And other are some tips. So be connected in this live. I'm going to give some tips also to how to keep your voice healthy, those who are watching this live. So to understand your speech language pathologist, speech therapist, especially if you're in India, how to differentiate, the best way is, I'm telling, first try to find out the college from where the speech language pathologist who is claiming he's a speech language pathologist, speech therapist, audiologist, he has studied. I'm asking first try to find out which college, because they can't give the wrong name of the college. Sometime in the social media, they can write XYZ degree or diploma, whatever it is, but they can't, those will be fake. They will not be able to put the college name. And if they're putting the college name, just try to find out their college was affiliated by which university. Then you find what degree he is having, graduation or post-graduation degree in the field of speech language pathology. And also try to find out in which year he got the degree. He is certified by the Rehabilitation Council of India. And what is the RCI number, Rehabilitation Council of India's number, if you are taking help from an Indian speech language pathologist. Those will be fake. They will not be able to put all this information. So this is the way how you can differentiate the fake. And if any fake speech therapist, speech language pathologist is harming by any means, especially in India, you can report to the Rehabilitation Council of India. They will take strong legal action. And once you do the Google search, RCI Rehabilitation Council of India, you'll be able to find the email ID also. And you can report about the fake people, those who are harming you. So this is just for awareness. And I was also telling I'll be giving some tips to keep the voice healthy. You should drink plenty of water. Water is a very good lubricant. So room temperature water taking is a very best idea. And then just avoid the throat clearing. Like when we do a very frequent throat clearing, there will be a lot of friction between the vocal cords. So you should avoid that. When you feel the throat clearing sensation, you drink the water. And avoid shouting. And if you're a teacher and the classroom is big, so you can ask your administration to provide the amplification device. Because when you will try to speak very louder or you'll shout, there'll be more stress on the vocal cord, and that may damage the vocal cord. It may result into the vocal nodule. So I have seen common vocal nodule among the teachers, singers, and the street vendors, those who shout and sell something. So, and avoid taking very cold or very hot thing. So that is also not very good for good voice. And if you are taking your dinner, don't go immediately on the bed to sleep. There should be some gap, maybe 1.5 hour or 2 hour between your dinner and the sleeping time. Because when you immediately after eating sleep, what will happen? The acid which will form in the digestive system in the stomach will come to the throat area, and it may be damage the vocal cord. So you should avoid that. And if you have the acidity, take the help of your physician to solve the acidity problem, because the acid may damage the vocal cord during the sleeping. It will accumulate in the throat. So these are the few things you can apply. And also I'll be suggesting do some physical exercise, walking, jogging, to have a good blood circulation and the healthy even that will impact your quality of voice. And if you have any voice problem more than 2 weeks, so just try to meet the healthcare professional and discuss the issues. And yeah, so these are the few tips I was thinking it may be helpful for the people. And please share this video so that maybe it will help this information to somebody. And if you're a singer, don't try to copy someone's style. Just try to develop your own style. If you're copying someone's style, so artificially you are doing mimicry and you are creating stress on the vocal cord. So that should be taken care, because I have seen that among some singers also the phonatory gap. Once those who try to just copy someone's styles, and I have seen the nodules, vocal nodules also. And when you are a public speaker, so when you are speaking, just take some water in between your speech. So this way you can keep your voice healthy. It can be useful for anyone. This tips for me, for any patient, or for normal people, professional voice users, for anyone. And now I'll be coming to the some question answer. So those who are joined this, just 1 minute. There are some questions. So I want to say thank you those who have joined this live. Yeah, I want to thank you all for joining us and watching us. And now I'll be coming to the question answer session. So please be connected, and I'll be reading the question, and then I'll be giving answer also. And before that, I just want to inform, today we are before treatment live, and he's having the, yeah, just tell about yourself and your problem so that people can hear your voice.
Yes, doctor, actually, my name is Tushanta, and I have the vocal issue, voice issue. Actually, the doctors told me there's a left vocal cord is not functioning well. So they suggested me to go for the surgery, and I'm waiting for surgery. In between, I was searching about the voice therapy, and I was found Dr. Sanjay, and I'm thinking go for that first, and then see how it is.
Yeah. So I'll be giving all the session by online mode and by online voice therapy only, because I'm in India, in Bangalore, and you are in Melbourne, Australia.
Yes.
So let's discuss the question answer. So you can mute your mic. So yeah, I'm able to read all the questions one by one. I'll be giving answer. There is a Samir Khan. He's saying, "Hi doctor, I have a stammering and excessive swearing problem." So Samir Khan, by speech therapy, we have seen improvement in case of stammering also. So you can call us, and our contact details are mentioned in the description of this video, and we'll do the perceptual evaluation, and after that we'll guide you better. And just for the information, I have seen in case of a stammering at our center about 80% treatment efficacy. Suppose 100 people are coming for a stammering speech therapy, I have seen 80 people will find some good changes or significant changes. 20 people will think that it was a wastage of time and money. So this is the truth. So before starting speech therapy from our center, this information is important, those who are planning. And of course, it is more than 20, so there is a hope, Samir Khan, yeah, for you. And so please contact us. Our contact details are in the description of this live. And Rama Niwas Sharma is saying, सर मेरी आवाज़ बहुत भारी हो गई है, स्पीच थेरेपी से कब ठीक हो सकती है? तो रामनिवास शर्मा जी, आप हमें कॉल कीजिए, हम आपकी आवाज़ को सुनना चाहेंगे, समझना चाहेंगे परसेप्चुअल इवोल्यूशन के द्वारा, और हो सकता है हम कुछ टेस्ट के लिए भी रिकमेंड करें। हम जो सबसे कॉमन टेस्ट रिकमेंड करते हैं अपने पेशेंट के लिए जो वॉइस की प्रॉब्लम वाले होते हैं, स्ट्रोबोस्कोपी, कई बार लैरिंगोस्कोपी से भी काम चल जाता है, और कई बार ऐसा भी होता है कि हम केवल सुन करके समझ लेते हैं कि ये प्रॉब्लम है और इसके अकॉर्डिंगली हम गाइड कर पाते हैं। तो हम हर बार जो है स्ट्रोबोस्कोपी, लैरिंगोस्कोपी रिकमेंड नहीं करते हैं, लेकिन फिर भी आप हमें कॉल कीजिए एटलीस्ट परसेप्चुअल इवोल्यूशन के लिए। और अर्जुन कुमार लिखते हैं, हेलो सर, हेलो अर्जुन। और अर्जुन लिखते हैं, सर मेरी आवाज़ वीक और ब्रेक है, और जब मैं ज़ोर से बोलता हूँ तो आवाज़ मोटी हो जाती है। तो अर्जुन कुमार जी, हम आपकी आवाज़ को सुनना चाहेंगे। मुझे थोड़ा बहुत आइडिया लगा कि आपके पास वॉइस की प्रॉब्लम है, लेकिन एग्जैक्ट प्रॉब्लम क्या है सुन के समझेंगे, फिर हम गाइड कर पाएंगे। और हमारा कॉन्टैक्ट डिटेल इस लाइव वीडियो के डिस्क्रिप्शन में जाइए तो हमारा वेबसाइट मिलेगा, वेबसाइट पे क्लिक कीजिए रीच मी, तो हमारा ईमेल आईडी, कॉन्टैक्ट नंबर और गूगल मैप पे क्लिनिक कहाँ पे सिचुएटेड है, सारी जानकारियाँ मिलेंगी। तो प्लीज़ रेफर द डिस्क्रिप्शन ऑफ दिस लाइव, विल फाइंड आवर वेबसाइट, ऑन वेबसाइट क्लिक रीच मी, विल फाइंड आवर contact number, email ID, and on the Google map where is the clinic situated. So thank you all for joining us and watching us. And today we are before treatment live with Tushanta, and he is having a voice problem, a kind of dysphonia due to unilateral vocal cord paralysis. And he is not in India, he is in Melbourne, Australia, and my center is in Bangalore, India. Today I'm working from my home, I'm not in my clinic. So today we are before treatment live, and in the future we are going to be post treatment live. So please subscribe our YouTube channel and don't forget to watch the Tushanta's post treatment live. So दोस्तों, आज हम ट्रीटमेंट से पहले लाइव हो रहे हैं तुशांता जी के साथ, और ये मेलबोर्न ऑस्ट्रेलिया में है और मैं बैंगलोर इंडिया में हूँ। आज हम लोग ट्रीटमेंट से पहले लाइव हो रहे हैं, और भविष्य में हम लोग ट्रीटमेंट के बाद भी लाइव होंगे। और आप हमारा यूट्यूब चैनल को सब्सक्राइब कर लीजिए और बेल आइकन को प्रेस कर दीजिए, ताकि जब भविष्य में ट्रीटमेंट के बाद लाइव होंगे तो वो वीडियो भी, वो लाइव भी आप लोग देख पाएँ। So thank you all for joining us and watching us, and thanks for asking the question, and I'm able to read all your questions, and I'm trying to give answer. If you have any question, please write in the comment box. And again, I want to say thank you Samir Khan for asking the question. Thank you Ram Niwas Sharma for joining and watching us, asking question. Thank you Arjun Kumar for joining us, watching us and commenting. And thank you Satish Sharma for joining us and watching us. Satish Sharma likhte hain, he's saying stammering also. So yes, Satish Sharma, stammering happened due to, as I told, there will be something lagging in the coordination among the speech production muscles with the brain, and in speech therapy we try to coordinate all those muscles. So for sound generation we need air pressure. So first I'll be working on the breathing muscles in case of a stammering, then I'll be suggesting some vocal exercise and trying to coordinate the breathing muscle, laryngeal muscles. Then I'll be coming to the words to coordinate the articulatory muscles, and then we'll coming to sentences, then conversation. So a step-by-step process. So once you will be start the speech therapy, you will get better idea. So of course, in case of a stammering, speech therapy may help. And Arjun Kumar is saying thank you Arjun Kumar for asking question, joining us, watching us, and thank you all for joining us. Thank you all, love you all. And if you have any question, please write in the comment box. And if you have any suggestion to improve our YouTube channel, please write in the comment box. And thank you so much for recently our YouTube channel subscriber number has gone up to 13,000, more than 13,000. So thanks for your love and support. Keep watching and keep sharing, so that people having communication disorder can reach to a right place and they can get hope and motivation. So thank you all. Thank you so much. And thank you to Shanta for supporting me for this. My passion is to create awareness about the communication disorder and about the non-surgical management of communication disorder across the world. And you have supported me. I'm very happy for you also, and hope I'll be able to correct your problem as well.
Thank you, Doctor.
So, thank you all, and love you all.